I do want to talk about the power of partnerships, which is what this is really all about. And the fact that Dr. Mason started off talking about programs that work for all patients. And we're talking about programs that work for all places and all people, and to understand that communities aren't just places that are looking for help, they're also places that have solutions. And so I've been working with community health councils, which has been on the ground since 1992, really dealing with issues of access. Initially just dealing with just kind of coverage issues, but as the definition of access has expanded, so has their agenda in terms of how we look at some of these issues. And so part of the presentation that you're going to hear today is the result of funded projects that have been on the ground, as I said, since 1999. Avelina has been the person in charge of the Know Your Digits campaign and also some of the clinical practice issues. And Dr. Vargas has been on the ground both as a clinician, as a researcher, as an advocate, trying to link the idea of the extending the clinical model back into the community, right? So we talk about having pharmacists on the community, well, on the team, but the community is also part of the team. And so how do we think about the role that community plays in a very kind of concrete way so you can leverage resources in a non-traditional way? And that's really what this presentation is all about. Rather than thinking that we have to start over, to recognize that there's been a lot of work in developing a case statement for what the problem is. The goals are in alignment. So when you start talking about blood pressure control, that is right there in terms of the top of the agenda with the Know Your Digits campaign. But again, it really is around closing the gap between the kind of clinical knowledge about what's happening in the provider office or what happens in the pharmacist's office, but also what happens when you send people into communities and they're faced with making choices. Are they going to be supported in those choices? So this is a campaign that's designed to say, we need people to know, first of all, where they are in terms of their control, and then what needs to happen next. And so that's what we're going to hear today. And so please, a round of appreciation for our panelists, Avelina and Dr. Vargas.
Thanks again, Dr. Lewis, for inviting us. Community Health Councils started attending. I've been representing since last August, and it's been a tremendous pleasure to be in your company and to hear about all the work that you all are working on and have been thinking about how what we're doing with the Know Your Digits campaign aligns with all of these other objectives. So again, I'm Avelina Waldman. I'm project coordinator of this campaign at Community Health Councils, and Dr. Vargas and I are going to be providing an overview of this project. Dr. Vargas and Dr. Lewis have been our technical advisors on this project, and I've been helping to coordinate the development of this awareness campaign. Community Health Councils in 2013 received a community transformation grant from the Centers for Disease Control and Prevention. It supports our United for Health partnership. It's a community-level effort to reduce chronic diseases such as heart disease, cancer, stroke, and diabetes. With our community partners that come from 5 project areas throughout Los Angeles County, we're working toward 4 goals: tobacco-free living, healthy eating and active living, use of high-impact clinical preventive services, and building healthy and safe environments. So today's objectives are to provide an overview of hypertension in Los Angeles County, provide an overview of the campaign development and formative research strategies. We will present campaign materials and resources, and present the campaign events and partner activities that are upcoming in August, and would like very much the opportunity to receive your feedback and have a discussion on partnership opportunities. And with that, I'm going to pass the mic over to Dr. Vargas.
Okay, thanks Avelina, and thanks Lavana for that introduction, and thank you all for inviting us here to come present to you. I see some familiar faces in the room. Just as a way of a bit of overview, and just to put this into context, as Lavana mentioned to you, this is part of a larger effort. In the sense of collaboration, it's a UCLA partnership, but it's really centered around the work that Community Health Councils has been doing as a community-based organization that is centered around advocacy for underserved populations in Los Angeles. And working with them, we've been participating in several activities which include outreach and awareness targeting underserved populations. But in addition to that, partnering with providers who serve these populations to either help them develop programs or to get support for programs that they have in place to actually try to change and reduce some of the disparities. In addition to this awareness campaign, we're working actively with a lot of the community health centers to identify best practices for them to get registries for hypertension, to put into place interventions and educational programs for their providers and their patients to actually reduce hypertension disparities and poor control in these areas. And in addition to that, we're actually looking even downstream. We have projects looking at the congestive heart failure admission rates from some of the more underserved areas in Los Angeles. I'm going to share with you, as part of this, just some of the background in terms of statistics. We'll have a focus on hypertension to give you the context of which we've been working with the community to look at hypertension disparities. Then Avelina will come back and talk to you a little bit about the work that we've been doing as a team to develop messaging to help really identify patients and get them to become aware of hypertension and some actions to reduce those disparities. So this is a map of Los Angeles County. The hard lines are geographic regions that are broken down into what we call service planning areas. We refer to them as SPAs. And it's one way in which the county actually collects health statistics for the region. And it's allowed us the opportunity to look at different types of resources that are available, including healthcare resources, as well as self-report and health statistics that are actually coming from the Department of Health Services database. Within these darker lines are smaller lines, health districts, which we also have some information. And for those of you who are familiar with the Office of Statewide Health Planning Department's OSPD database, discharge data from that system actually allows us to look at variation in admission and discharge rates for different conditions based upon some of these smaller geographies. In general, hypertension in Los Angeles, and this is coming from the California Health Interview Survey. And just to back up for a second, just want to recognize my colleagues from the UCLA CTSI Community Engagement and Research Program. They have a hotspot analysis team, which if any of you are interested, you can reach out to me. They assist in preparing health statistics, maps, and data for community-based organizations and for research projects. And they were very instrumental in helping prepare a lot of the slides that I'm going to show today. So this is actually from the California Health Interview Survey. And in terms of self-report of hypertension in Los Angeles County, it's around 28%, which is not that far off from national estimates. This is self-report. As we know, especially from if you look at MMWR and things like NHANES, where you actually can measure self-report to patient report, it's not always that accurate. And in terms of people who have high blood pressure that are not aware, so this may be an underestimate of what the true numbers are. But if we go back to those service planning areas, you can see that there's some variation across Los Angeles County, even in self-report of high blood pressure. Specifically in this region here, South LA, and I'm going to come back to South LA a lot. This is South LA on the map. It includes Compton, Southwest, and South-Southeast, but people who might know areas called Crenshaw. This is Crenshaw Boulevard. Roughly the 10 runs here, the 405 runs here, the 105 here, and the 110 here. So trapped between those highways is South LA. And when we start to look at health statistics, you'll see that there's a spike there, and sometimes in not so good areas. Just in terms of unawareness of hypertension, this data is a little bit old. It's mostly from NHANES because it allows us to look at data in which people have had blood pressures measured and then asked, do you know if you have hypertension, or has your doctor ever told you? Overall, we've seen some improvement in awareness. So if we look back at the second wave of NHANES from 1976 to 1980, roughly there was a 49% unawareness rate. So that means people whose blood pressure was measured to be elevated and have hypertension but not be aware, 49% in that second wave. To the 2007-08 wave, that actually has come down to 19%. Okay, so I mean, there's a good news story nationally. You know, people are becoming more aware. People are either getting checked and getting screened, or you know, they are getting. If they haven't, their providers are communicating that to them more. So there's probably a multi-level effect there. When we look at Los Angeles, this data comes from NHANES data that was parsed out by a group led by Olives and colleagues that pulled out some of the NHANES regional data to look at county level variation within NHANES. And in that last wave, they estimated that roughly 25% of women were unaware and 20% of men were unaware. So a little bit higher specifically for the men. When you actually pull out the last wave of data across race and ethnicity, we don't see that much variation in terms of unawareness. Actually, the level of awareness across African Americans, whites, and largely Mexican Americans, which is the Latino subgroup that they have the most data for in NHANES, is pretty flat across, roughly around 20% in that last wave. When we look at Los Angeles in a database that was developed through a national screening program, a privately funded screening program, that did target and oversample minority populations, they got a much higher rate. Also, roughly within that same time period, where they found 48% of the population was unaware. So we've seen different statistics, and somewhere between 20 to 48%, somewhere in between is probably where the truth lies. That being said, getting back to our maps of LA, as we know, age, as you increase in age, the likelihood of hypertension increases as well, and we see that in those over 45 in California, 42%, in Los Angeles, 45%. And then when we start to look at some of these sub-areas, that South LA area, over half the population over 45. And this is once again from CHIS, so this is self-report. So very high rates of hypertension in Los Angeles, and some significant variation across these regions. If we look at the regions and we compare that South LA to the rest of LA County, if you look at some of the major predictors of cardiovascular disease, hypertension is the one that is most prevalent in these populations. When we shift now to look at hospitalizations related to hypertension, so this is a different database. This is coming from the hospital discharge database. Looking across these regions, and you look at hospitalizations, either ER encounters or hospital admissions for hypertension as the primary diagnosis. Okay, per 100,000, this is the breakdown that we get, and now we start to see very big differences. Okay, and just to kind of reorient you to that map. So west, that's kind of like Santa Monica, Westwood area. The metro is kind of downtown. East is kind of south of downtown and kind of east of downtown, and then that South LA area between the highways that I mentioned to you. Okay, very, very, very big differences. Okay, in what's going on here in terms of what we would consider an outcome, right? Hospitalization, potentially preventable hospitalization. I mean, it's encouraging to hear the prior speakers to say that, to know that there are these efforts that are focusing on readmissions and hopefully admissions for hypertension. I think one of the challenges and one of the questions will be is to look at this based upon geography, right? I mean, we have the players that are at the table, and sometimes it's hard to get inpatient, outpatient, and pharmacists, and then to get that covered and reimbursed in terms of Medicare populations versus Medi-Cal. And we'll get into some of the demographics of South LA, and that may give us some sense of what may be driving some of this. This goes back to the California Health Interview Survey, and these are people who are taking medications for hypertension. From the national data, we know that different subpopulations, particularly African Americans, although similarly aware, are often not using medications as often as other groups. And if you look at the comparison, kind of going back to that West LA, the area with the lowest amount of admissions for hypertension, and South LA with the highest, if you look at, there's kind of an inverse relationship there, at least in terms of just looking at the graph. These are not statistically associated analyses, but just looking at the raw data, you can see some differences that give us some information. This table parses out the hypertension admissions and ER visits by the health districts. Okay, so this is a more smaller area analysis, but if you look at the top five, these are still all, these top five are roughly South LA. They bring together South LA. But if you look at the variation, you can see significant variation, right? So that West LA area versus here. And then just overall, this just kind of parses out the discharge rates over different time periods. We can actually see that the hypertension ED encounters are actually increasing. And this is even across some of the areas where the overall numbers are low. Okay, so there is still some work to be done, and it's not entirely clear what's driving this, but those numbers are going up. And then, of course, the differences that we highlighted before. The downstream effect of hypertension, I don't know if I have that slide in here. There was so if we look at congestive heart failure admissions, and particularly in terms of readmissions and the impact that congestive heart failure as a diagnosis has in one of the leading causes of hospital readmissions, when you look at comorbidities, so people who have additional diagnoses in addition, when they are admitted for congestive heart failure, hypertension is one of the highest comorbidities associated with heart failure admissions, and you can see that there is even a higher rate of that South LA population of having hypertension. Anecdotally, one of the other projects that we're working on is really trying to address this disparity in congestive heart failure admissions from people from South LA. And we were talking to different cath labs and different cardiology units that actually get the bulk of these patients. And one of the things that they anecdotally tell us is that it's not a lot of people coming in with ischemic heart disease. A lot of the patients who are coming in from South LA in these areas is hypertensive heart disease. They're cathing, they're clean coronaries, but they have a lot of untreated, undiagnosed hypertension as the driver. And that's somewhat supported by the comorbidity data. And this just is actually unique admissions as opposed to total admissions. So this includes the readmissions. This is just the unique individuals, but you can still see South LA in particular, big driver of congestive heart failure admissions coming from that community. So that being said, the partnership with community health councils is, I believe, really relevant because, as LaVonna mentioned to you, they have over 20 years of experience working with community members, community-based organizations across health and all other types of activities that have been advocating not just for excess healthcare resources, but to advocate for other social support and things that actually help to improve the socioeconomic status of these communities. And we feel, and those of us who are in health services research, and I see Alan here, those who are in disparities research, we know that the socioeconomic differences in a lot of the communities and populations who suffer the health outcomes, must be a component of any of our solutions to really turn around the disparities in health outcomes. And so that being said, when we look at these numbers from South LA, if we look at some of the socioeconomic characteristics of these communities, this slide graphically shows you the rates of uninsurance by the health districts. Okay, and so the dark red are areas in which over a third of the population are uninsured. And this is from the Health Interview Survey back in 2009. Okay, and if you look at that South LA area, okay, more than 30%, really, more than 28% of the population during that time period was uninsured. Okay, and that's that area where we're getting these drivers of excess people in the negative outcomes. This chart looks at 100% of the federal poverty level, so roughly a salary of $25,000 a year for a family of four. And if you look at the color coding here, the dark red areas are where more than 40% of the population are under the federal poverty level. Okay, so that's 40% of the population, and you can see here that South LA area is coming up, some of the East Valley areas coming up. And just as a way of a segue, as Albalena starts to come on board, as LaVonna mentioned to you, the United for Health project targets several areas of Los Angeles County. A lot of our work is with groups in South LA area and around South LA, including the Wilmington area. And then we have Pacoima as well. Right, so that's like Central LA, East LA, South LA, Wilmington right down here, and then Pacoima is right up in here, just abutting East Valley, right? I'm from New York, so you guys got to help me with this LA map. But you know, it's the work that they're doing and the relationships that they have with these groups are groups that have been in these communities for a long time, and they're not necessarily health-related groups. These are groups that are looking at physical activity, environment, social justice, reducing violence, things like that. So we're bringing together partners who are not typically in the room with the policy analysts and researchers and health researchers. The racial and ethnic composition of these communities, quickly just the South LA area. So this green is Latino, and the reddish brown is African American. So if you look at South LA in particular, the one that's highlighted, it's over 90% black and Latino. If you look at the other areas, particularly that metro area, once again, a large number of Latino population and an increasing number of Asian Americans. But the racial makeup and the racial and ethnic makeup of these communities is largely Latino and African American. This slide, this is kind of a little bit of a hybrid. These first three bars really kind of get at data from the California Health Interview Survey. Oh no, this is from the Los Angeles County Department of Public Health Key Indicators of Health. So this is another survey, but it asks people about insurance and self-report difficulty accessing care, okay? And then did they not get a needed prescription because in the past year they couldn't afford it, okay? And then comparing South LA to the rest of the county. And for these three measures, you know, once again, that over 30%, and I believe this includes children as well, so that's why this number is a little bit different than the last one I showed you. More than a third of the population uninsured, almost 40% self-report difficult access to care. 20% not getting prescriptions because they couldn't afford it. Okay, so despite, you know, our efforts, and I think when we begin to think about designing these efforts, if we're really going to try to level the playing field, we have to think about these populations that are left out, that are either uninsured or not in our systems of care that might be able to provide some of the services that we've talked about earlier. And then this last slide is actually from a different database, back to the Health Interview Survey. And this is of people with heart disease, how confident are you that you can manage your heart disease? So if people responded, my doctor told me I had heart disease, they follow up, how confident are you in managing your disease? And if you look at the South LA area, less than 40% of the people with self-report heart disease, okay, feel comfortable managing the disease. So when we talk about opportunities for patient education, we talk about opportunities for, you know, linking some of these ancillary services and support to make a difference. I think that comes into play. I know we're kind of running short on time, so I'm not going to go through everything because these just kind of reiterate some of the same principles when we talk about behaviors or access to care, things that might be related to people having lifestyle changes in terms of healthy diet that would reduce their likelihood of either getting hypertension or help them to better achieve control. You know, we're seeing the same themes, you know, less than the average in terms of South LA and East LA, fast food intake higher than average, obesity higher than average. And then one thing I think that doesn't get a lot of attention when we talk about hypertension, but something that when we have community forums and we talk to community members, is stress. And in terms of stress and its role in causing hypertension and reducing your ability to control it. And I put this slide in here because when we're going through the deck, I thought that this was interesting and important. And although the overall numbers are not great, because we're talking about 15%, but that disparity in terms of individuals who have experienced a serious psychological distress within the past year, in these communities, particularly in South LA, more than 2 or 3 times as high as other regions. And so I think we have to think about this whole bio-psycho and social component of disease. And those of us who have been trained in medical school about, that model of disease, we know that these things all come into play when we want to try to improve outcomes for our patients. So that being said, in summary, hypertension is a major public health concern in LA. There's regional variations in rates of hypertension as well as in hypertensive-related disease outcomes. It disproportionately affects community with higher rates of uninsurance, poverty, and racial and ethnic demographics, or minority demographics. These communities also have less access to care and higher exposure to behavioral and environmental risk factors for hypertension. So we have to think about this in that complete model if we're really going to try to address the disparities we see in these regions. And many of these communities are the focus of the United for Health Partnership. And with that being said, I'll switch over to Avelina. Thank you.
that certainly lays out the need for raising awareness of knowing one's blood pressure and controlling blood pressure in these communities in Los Angeles. So with the grant that community health councils received from the CDC, we then embarked on conducting our own independent formative research in order to assist in the development of this campaign. And these are some of the people at community health councils that were involved in that. The first step was really to establish our advisory committee, and these are the organizations that really informed the areas that we needed to examine in our formative research analysis. We have members from the American Diabetes Association, American Heart Association, Anthem, Association of Black Cardiologists, HealthNet, Kaiser Permanente, LA Care, the Department of Public Health, Northeast Valley Health Corporation, Annenberg, and the YMCA of LA. And over the course of 3 meetings, this cadre of experts helped really delineate the areas that we needed to further explore that were going to be relevant in terms of developing this message for the residents in our 5 project areas. So our formative research data collection methods included both qualitative and quantitative. We conducted focus groups, key informant interviews, and surveys. So for our focus groups, we really wanted to the aim of our focus groups was to explore awareness, knowledge, and attitudes around high blood pressure and around preferences for trusted resources for health information. Between September and December of 2013, we conducted 5 focus groups, and they were conducted in the communities in Wilmington, South LA, and East LA. We had a total of 56 participants, African Americans and Latinos, and focus groups were conducted both in English and in Spanish. We conducted surveys of our focus group participants, and it was really to collect information around demographics, computer and social media usage, internet access and usage, and whether the prevalence of texting and preferences around texting. This survey was provided in both English and Spanish, and 56 of them were completed. We also conducted key informant interviews with the members of our advisory committee, and the purpose of the key informant interviews was to delve deeper into the unique conditions, barriers, and opportunities in high blood pressure prevention and management in LA County. We conducted 8 interviews between July and October of 2013, and they represented members of CBOs, 4 health plans, and 1 public sector agency. So some of the highlights of our formative research include that among consumers, there was low awareness of their own blood pressure levels, that they placed high value on testimony from their own community and social network around hypertension. So the value of interpersonal communication and hearing from their peers and trusted resources was very big. They helped us identify the need for real and actionable steps that are manageable, that this needs to be communicated to consumers. And they identified the need for better promotion of community resources and better access to healthcare providers. The agencies really helped identify that with the implementation of ACA, there were opportunities to promote hypertension screening and management, as it's a free service, as many people would be seeking at this time to be obtaining healthcare coverage. What we really heard among both was that there really has to be a mix between both traditional or interpersonal communication and sort of these newer social media strategies. These are the people from community health councils that were involved in campaign development, and LeGrant Communications is a marketing firm that was brought on board to take the lead on message design, material design, and really strategies in getting the message out. So first, our campaign goals were informed by our primary data collection from the focus group surveys and key informant interviews that we conducted. And as a result, we developed this campaign that we hope will raise the awareness of the importance of preventing and managing high blood pressure, to encourage consumers to seek health care for screening and management of high blood pressure, and to motivate those who are not insured to enroll in new healthcare coverage options. So again, our purpose is really to motivate the consumers to know what their blood pressure is and to talk to their healthcare provider about how to effectively manage it. And if they don't have a healthcare provider or don't have access to healthcare, we want to be able to provide resources on how it is that they can enroll in healthcare. So there are three main strategies for the campaign. There's interactive consumer engagement and educational activities. Through the media, we will outreach through traditional methods as well as utilize social media. And the key component is partnerships with a range of organizations, agencies, and businesses to promote the message throughout the county. So the community outreach component, our strategy around that is to coordinate with our partners to execute and promote various events, and will be both educational and interactive throughout the month of August. And we will have a launch event on August 7th, which will be our kickoff event, and then we will also provide, we've been assisting in the coordination of blood pressure screenings at a variety of different events around the county. We have developed some materials around to facilitate community education. They include consumer fact sheets, posters, a website, and some trackers, and I'm just going to show you what they look like. So you all have, I believe, copies of the fact sheet, the consumer fact sheet that was developed. It's both in English and Spanish. And it lets people know what their risk factors are for high blood pressure, lets them know why it's important to know their digits, to know what their blood pressure level is, and if they don't know what it is, to go and find out what it is. We provide a sort of the general reference table for what category blood pressure readings might fall into, and what it is that people can do to control it. We also provide a link or information about, say, going to our website for more information, and then we also have it in Spanish. We also developed posters that will be distributed to our partners, and also to post in their waiting rooms or in their offices. We're also thinking about providing them just to businesses in the community if they just want to put them in their windows. Let me see if I can get this so that you can see this thing all on one screen. So again, we're saying know your digits, be in control. Please go to this website. We're letting people know that this is an important public health issue in their community, and to please find out resources on how to find out their digits and keep them under control. And this is the one in Spanish. We are also developing wallet-size blood pressure trackers. Let's see, playing with sizes. Which this is the front side. I didn't include the flip side, but this is a 3-fold that will fit into people's wallets, and it will be distributed at community events where they are getting their blood pressure read. And it includes the same messaging on why it's important to know your digits, what puts you at risk for developing high blood pressure. Of course, highlights our major partners. On the flip side, it gives people several lines where they can track on this date what their blood pressure was, and so that it's something that they can keep track of, and then it can be a tool that can facilitate patient physician communication around the issue when they go and see their healthcare provider. And there it is in Spanish too. So then the second strategy is the media outreach component, and a media plan has been developed to promote campaign activities throughout the month of August. We will have a media breakfast at our launch event on August 7th, and we will be providing community health councils and LeGrant Communications will be submitting weekly columns and issuing press releases to raise awareness of this campaign. We will also be posting bus interior cards and billboards in various places around the county. And partners will also receive a media kit where they can, through their own relationships, promote the campaign. Newer or social media strategies have been included. And we've developed infographics and have developed Facebook postings and tweets to put on Twitter daily. So here's one infographic. It's Los Angeles. And it gives people the various statistics on the prevalence of high blood pressure, and if high blood pressure is uncontrolled, how it puts one at greater risk for these other heart health related issues. Always sends people back to the website for more information. This is another infographic that sort of indicates what one's risk is for high blood pressure. There are risk factors that people can control, on there, and or have more control over, and things that people have less control over. So we're really also wanting to draw attention to the risk factors that one can modify. This is a fact sheet for media partners, lets them know how they can participate. So then there's the Know Your Digits, which has kind of become the home for the campaign. Both consumers and partners are sent back to the campaign for a variety of resources. There we are providing a range of interesting and relevant content to promote awareness, to promote the campaign, and to promote the partners and the resources that exist within the community. That's one part that we learned from our formative research, is that people are not always aware of the resources that are within their reach. We also provide facts and statistics and frequently ask questions regarding high blood pressure, and there, I will show you in a minute, our events calendar. So let me just go to that. So our Know Your Digits campaign lives on the Let's All Get Covered, which is our healthcare access initiative, in order to facilitate people getting connected to those resources. But people can access the website by just typing in Know Your Digits spelled correctly on their own. And here we provide various resources for the consumer. It tells consumers and partners what they need to know about the campaign, and establishes why this is important among African American, an important issue among African Americans and certain Latino populations, what the goal of the campaign is. And then here, individuals, anyone can download the posters, the fact sheets, and then if someone is really interested, they can become a partner by clicking here, and this will take them to the Community Health Council's website, which has partner-specific information and indicates who our ever-growing list, which has been really exciting, list of community partners. So we'll go through that in a minute. We also, I'm just going to show you a couple more areas, this is understanding high blood pressure. So it tells people a little bit more about high blood pressure than what exists on the fact sheets. There are a lot of links on here, and we didn't want to reinvent the wheel. We just wanted to bring a lot of resources that exist out there all together under a single umbrella, and provide people with links to American Heart Association, for example, on various educational resources. And we also want to promote healthy lifestyle choices, so people can go here and learn more about that. It's fairly simple to navigate. We didn't want to make it very deep. We didn't want people to have to go too far down into a website. So this is exciting. This is our event calendar. This is really where our August activities are. We can look at this in a variety of ways. We'll look at it as a list. So these highlight all of our partner activities that are occurring throughout the month of August. They include, as I mentioned before, free blood pressure screenings, but they're also exercise events and open houses and something at the Mexican consulate, and our materials are being provided at movies at the park, and Zumba. It's really all over, and that's really exciting. Our launch event, I will draw this up here, is being held on August 7th, as I've mentioned, at the Ascot Library, located here on West Florence Avenue, from 10 to 1 to the public. The media event will occur in the morning, but we will have many tables set up and cooking demonstration. Northgate is one of our major sponsors, and they will be providing free produce to the attendees. We've partnered with the Los Angeles Public Library, and they're providing the space as well as helping to coordinate various Know Your Digits activities throughout in libraries throughout the area. American Heart Association is also partnering with us as well as a major sponsor. And Everest College has been significant in terms of scheduling, helping us to find screeners for all of these scheduling, for all of these blood screening events. Because it's been actually tremendous, the need that's been expressed for providing these blood pressure screenings in the community. So I'll just go back, show you the month. There's a lot going on over the course of August. We're updating this all the time. Right now, the campaign is limited to August. However, there is hope and efforts are being made to expand this type of campaign to include other digits relating to obesity and diabetes and other heart health related issues, and also for it to be more of a year-round campaign. So I'll switch back to the presentation. So this, again, is one of our infographics. We'll talk a little bit more about our partners. Community Health Council does not have the reach to bring the message out into the community on its own. And overall, the organization has relied on partnerships in the community in order to implement its work and to highlight the work that is already occurring within the community. So we have over 25 partnerships to date, and the enthusiasm has been really to partner with the campaign has been tremendous. We are supporting our partners by providing them with informational toolkits, which will include the calendar of social media postings that they can post on their own Facebook page and Twitter account, as well as I mentioned before, press releases and whatnot that they can release through their own relationships. We are providing them with materials, so the fact sheets and the posters, the blood pressure trackers. And we're hoping that they, in turn, can utilize their existing communication channels to disseminate the information. So I just want to show you really quickly the toolkit here. Okay, so partners get a toolkit that includes a welcome letter, and this is the press release. Then here is the social media posting calendar. And then what we would like to hear from our partners in return, and we are hoping that this won't be onerous, but we would like to know what they're doing. we would like to be able to know so that we can incorporate that into our lessons learned, and also then learn how the campaign has enhanced their existing services, and whether it's assisted in the development of some new heart health related initiatives. So this is an event tally. We're hoping to collect some hopefully simple information from the partners on the event, and at blood pressure screening events, whether how many people were screened, how many people found out they were hypertensive, how many found out for the first time, etc. So again, our partners will be promoting the campaign through their own communication channels. They'll be distributing campaign educational materials, either through their existing programs, or maybe they've decided to try something new. They'll be hosting booths, tables, and distributing materials, providing screenings throughout the month. Some organizations are identifying spokespeople to speak at the media event at the launch, or at other events throughout the month. And we are always asking and open to thinking about other ways that the campaign can reach the community. Our major partners again are Gonzales Northgate Market. They're actually doing blood pressure screenings various stores throughout the month. Everest College is assisting. They are providing the screeners. Los Angeles County is integrating the Know Your Digits campaign into their programming at the public library. And American Heart Association is providing materials and support. And this is, as I said, this group is growing every day. So right now, I will say this is a partial list of our various community partners. And as you can see, there is really a wide range of the types of community partners that have signed on to join the campaign. I went through the toolkit. And really, the action plan for our Know Your Digits Being Controlled campaign is that we're wanting to raise awareness that high blood pressure is preventable and that it needs to be controlled. We want to raise awareness around Covered California resources and where people can get care. We want to motivate community to know their digits, to get screened, to access medical care, and to make lifestyle changes. And ultimately, as really is happening with the partnerships component, is facilitating connection.